There's something you probably did this week, maybe even last night. You scratched yourself, and then you forgot about it, and I completely understand that. An itch seems so insignificant, so small, so ordinary. But let me ask you something I want you to take seriously. What if that tiny little annoyance was the only signal your body had to tell you something very serious was happening on the inside? Because there are diseases that don't hurt. They don't bleed. They make no noise. They move forward in complete silence while you go on with your life, drinking your morning coffee, watching your favorite shows. And by the time they finally show themselves with full force, they've already done too much damage. What those diseases do, and this is what very few people know, is send signals. Signals that seem ridiculous. Signals we dismiss because they seem too simple to be anything serious. A persistent itch. That's all. Just a simple itch. Today, we're going to talk about 3 specific places on the body where a persistent itch is not a skin problem. It's an internal alarm. And if you're already over 50, if you have diabetes, high blood pressure, or a family member with liver or kidney problems, what I'm about to tell you today could be the most important warning you've heard in a long time. Stay with me until the end, because I'm also going to explain exactly what to do, without panic, without exaggeration, with concrete, simple steps. First, I need you to understand something that completely changed the way I practice medicine. When I was studying, we were taught to look for obvious symptoms: pain, fever, visible swelling. But over years of seeing patients, I learned that the human body is far more intelligent and far more subtle than that. I learned that sometimes the most important symptoms are the ones that attract the least attention. Our skin is the largest organ we have. Most of us treat it like a wrapper, like gift paper, as if what matters is only what's inside. But the reality is that the skin is connected, through blood, through nerves, through fluids, to everything happening inside us. When the liver accumulates substances it can't eliminate, those substances end up in the bloodstream. The blood reaches the skin, and the skin reacts. When the kidneys begin losing their ability to filter, the waste products that should leave through urine stay circulating through the body. The result is nerve irritation that feels exactly like a normal itch, but has nothing to do with the surface of the skin. When a skin cell starts growing in a disorganized way, it releases chemical signals, and those signals activate nearby nerves long before the eye can see anything concerning. Your body doesn't have a voice, it can't speak, but it has ways of communicating, and one of the most frequent and most ignored is the itch. Now I want you to meet Miriam. Miriam is 62 years old. She's a grandmother of 4, retired, active, a woman who never missed her regular checkups and who always took pride in her good health. 2 years ago, Miriam started waking up in the middle of the night scratching her legs. At first, she thought it was the change in temperature. She bought some cotton socks. Then she thought it was her body lotion. She switched brands. Then her daughter told her it was stress from watching the grandkids. Miriam accepted that. She kept scratching. Every night, for months. One day she went to the doctor for a headache and, almost as an afterthought, mentioned the itching. Her doctor ordered a full blood panel. The results came back 3 days later. Miriam's kidneys were functioning at 38% of their capacity. She had advanced chronic kidney disease that no one, not even she herself, had suspected. Today, Miriam is under treatment. Because it was caught at a point where something could still be done. Because a doctor took that itch seriously. But Miriam told me something I can't forget. She said, "Doctor, I thought that if something bad was happening to me, it would hurt. I never knew something this serious could feel like just an itch." That is exactly what I want you to remember today. Let's go through the 3 places. Pay close attention because the details matter. The first one surprises most people because it seems completely illogical. The palms of the hands and the soles of the feet. Close your eyes for a moment and imagine this sensation. An itch that's underneath the skin. Not on the surface, but deeper. Like something incredibly tiny is crawling between your bones and your skin. And the most maddening part is that no matter how much you scratch, the feeling doesn't go away because there's nothing on the surface to scratch. That, exactly that, is what a person feels when the liver is in trouble. The liver has a function that very few people understand well. It produces something called bile, which not only helps digest the fats we eat, but also acts as a drainage system. Many waste substances travel through bile until they leave the body. When the liver becomes inflamed, damaged, or when its ducts become blocked, that drainage is interrupted. The substances that should be leaving start circulating through the blood instead. They reach the nerves in the skin, and they activate them. They irritate them from the inside out. For reasons we're still studying, this internal irritation has a very strong preference for two areas: the palms of the hands and the soles of the feet. These are zones with an extremely high nerve density, which is why they feel this signal with greater intensity. What makes this especially dangerous is that serious liver diseases, like chronic hepatitis, cirrhosis, or even blockages caused by tumors in the bile ducts, can be quite advanced before the better-known symptoms appear, like yellowing of the skin or a swollen abdomen. This itching in the palms and soles can appear months earlier. It's a window of time, and if we take advantage of it, it completely changes the outcome. If you have this sensation, and especially if it gets worse at night, don't treat it with creams. Ask your doctor for a liver panel. It's a simple, quick, and inexpensive blood test that can give you a very important answer. The second place is different. It's not concentrated in one spot. It's an itch that spreads. It starts somewhere, then shows up somewhere else. Today it's the lower back, tomorrow it's the thighs, the day after that, it's the abdomen. It's a wandering itch with no apparent logic, usually more intense after a hot shower, and it practically won't let you rest at night. When the kidneys begin to fail, their ability to filter the blood decreases. What used to leave through urine now builds up. Urea, phosphorus, various toxins that the body produces as part of its normal metabolism. These substances, circulating through the blood at elevated levels, create low-grade inflammation throughout the entire body. The nerve endings in the skin are extremely sensitive to this chemical change. The result is this itch with no visible cause. You can look at your skin and see absolutely nothing. No rash, no redness, nothing. But the sensation is real and it is intense. Chronic kidney disease is one of the most underestimated health problems in the world. Millions of people have it without knowing it, because in its early and middle stages it is completely silent. It doesn't hurt. It doesn't cause fever. It doesn't interfere with appetite or energy in any obvious way. The highest risk groups are people with long-term diabetes, people with poorly controlled high blood pressure, adults over 60, and people with a family history of kidney disease. If you fall into any of these groups and you have this wandering itch, don't wait for another, more serious symptom to take action. A creatinine test in the blood and a urine sample to check for protein. That's all you need to start understanding how your kidneys are doing. 2 simple tests. 1 conversation with your doctor, potentially a massive difference in your quality of life. The third place is the quietest of all, but also the most localized, and for that reason, the easiest to identify if you know what to look for. 1 spot, a single spot on your body that itches, not your whole body, not your palms or your soles. A mole that suddenly, for no apparent reason, starts to itch. A flat, dark patch of skin that never used to bother you and now itches from time to time. A small area of skin that looks like a shallow wound that never quite heals and is always a little irritated. The people I see in my practice tell me the same thing over and over. I thought it was a pimple. I thought something had rubbed against me. I thought it was just the fabric of my clothing. And that is exactly what skin cancer looks like in the beginning. Something completely trivial. Cancer cells, as they multiply in a disordered way, release chemical substances that stimulate nearby nerve endings. The result is a constant, localized itch that doesn't go away. Sometimes this itching is the first sign, even before the lesion changes in any visible way. Melanoma is the most dangerous type of skin cancer. It's not the most common, but it's the one most capable of threatening your life if it's not caught early. And its most treacherous characteristic is that it can look, at first, like a perfectly normal mole. There are warning signs we all need to know. A lesion with an irregular border, as if it were badly drawn. A patch with more than one color inside it, brown with black or with pink areas. A mole that is growing or changing shape. And, what concerns us today, any skin lesion that starts to itch without a clear reason. The rule I give all my patients is very simple. If you have something on your skin that itches, that bleeds, or that doesn't heal within 3 weeks, go to a dermatologist. Don't put it off. Don't watch it hoping it gets better on its own. Go. Skin cancer detected at an early stage has cure rates that exceed 95%. Detected late, the picture changes dramatically. The difference between the two can simply be having taken that itch seriously in time. I know what you're probably feeling right now. A little unsettled. Maybe mentally reviewing the itches you've had lately, wondering if that spot that bothers you from time to time should worry you. That is completely normal, and honestly, it's exactly the right response. Not panic, not obsession, but attention. Because the alternative, ignoring these signals and keep putting on cream as if nothing is happening, can have consequences none of us want to face. But I also want to be completely honest with you, because you deserve that. The most common itch, the one most people experience, especially after 50, is none of the three I described. The most frequent cause of itching in older adults is something called xerosis, dry skin. As we age, our skin produces less natural oil. It becomes thinner, less elastic, more fragile. The result is a generalized itch, especially on the legs and arms, that gets worse in winter, in dry environments, or after bathing with very hot water. This benign type of itch responds very well to simple measures. Lowering the water temperature when you shower, using soap without fragrance or alcohol, applying a thick moisturizer immediately after bathing while the skin is still slightly damp, drinking water throughout the day, wearing clothing made from natural materials that don't irritate. If you follow these steps for 2 weeks and the itching clearly improves, that was probably all it was. But if you do all of this and the itch is still there, if it doesn't improve, if it actually gets worse, if it wakes you up at night, if it's so intense that it's hard to stop thinking about it during the day, that is no longer dry skin. That is your body telling you something more. And the sign that you absolutely need to see a doctor without further delay is when the itch comes with other things. A tiredness that makes no sense, even when you've slept well, swelling in your ankles or feet, changes in your urine, foamier, darker, or going less frequently, weight loss without having changed what you eat, a low fever that comes and goes, or that yellowish tint to the skin or the whites of the eyes. If you have itching plus any of those things, don't wait. Call tomorrow morning. I want to finish with something I believe deeply after years of caring for patients. The biggest obstacle to good health is usually not a lack of money or a lack of access to doctors. The biggest obstacle is the very human tendency to normalize what bothers us, to get used to it, to think, it'll probably go away on its own. The body is extraordinarily patient. It endures a great deal before it complains, and when it finally starts sending signals, we often dress them up as something trivial. Stress, old age, the weather. An itch that lasts more than 2 weeks, that has no clear cause on the surface of the skin, and that doesn't respond to basic care is not trivial. It's a question your body is asking you, and it deserves an answer. You don't need to panic. You don't need to self-diagnose yourself with the worst thing you find online. You just need to go to the doctor, get the tests done. No, because if something is wrong, you want to know now, when the options are many, not 6 months from now, when they are few. And if everything is fine, which is what happens most of the time, you go home with peace of mind, knowing you paid attention to your health. That is what I'm asking of you today. Listen to your body. Take it seriously. And when it has something to say to you, don't answer it with a cream. Answer it with a doctor. Take good care of yourself.